Hey everybody, what's up? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance based in New York City. Today we're back with Dr. Naim. What's up, Dr. Naim?
Hello again. How are you?
I'm doing great. So we've got these audiologists at home episodes we've been doing. This is actually episode, I think, 31.
Oh, wow.
Yeah, I'm pretty sure. So we've been doing these quite a bit since we've been on lockdown with the whole coronavirus situation. Trying to provide some value and just some information for everybody out there who's got questions related to hearing and balance related issues. And we've got a topic today that is super relevant, as they all are, but this one even more so because our lives have been turned upside down because we're out of the office.
Right.
And we need to see patients face to face. Let's be honest, for the majority of the things that we do, just like most doctors do. But some of the things we have the ability to do remotely. So the question for you is, what types of things can we do as audiologists remotely for patients that need our services?
So this is super applicable given what we're going through in our world right now. And like you said, yes, while most of our things we actually do need contact with our patients, there are a couple of things that we're able to do, just like a video conference like this. So the first thing is a tinnitus consultation. If a patient is struggling with their tinnitus, first time eval, follow-up eval, we're actually able to walk them through the steps, management techniques. A lot of the counseling that we would do face-to-face can absolutely be done in a video conference. For example, also if they have their hearing test, whether it's from us or from somewhere else, we can go through that hearing test with them, just help them understand it a little bit better, which is actually very similar to the next thing that we're able to do, and something that we offer in our practice is second opinion consultations. So we have a hearing test, someone else has met with another audiologist and they were given some recommendations. We can do second opinion consult where we'll talk about, okay, whether or not we would recommend the same things, we agree with those recommendations, take your needs into consideration, and maybe formulate a different plan. And something else that actually we've been doing with our patients now throughout this time is hearing aid repairs and troubleshooting. So through what we call remote care, the patient just has to have a smartphone. They see us through video. They're wearing a little neck loop that connects to the hearing aids. I'm able to go into a software and run a bunch of tests, run a quality assurance check, run feedback tests if they're experiencing feedback, make adjustments. And even if it's not adjustments, I can look at the hearing aid to see, is there any wax in the filter? I can walk them through how to change the wax strap. So we have a lot of capabilities through telehealth and remote care. So yeah.
That's awesome. You know, it's interesting because although there are so many things that we have to see patients face to face for, so for instance, like true diagnostic assessments, whether that's for hearing, we need to put our hands on the patient, look in their ears, do some other tests that require equipment to really assess what's going on. But that said, through these concepts of remote care, we have the ability to troubleshoot for patients. It prevents them from having to come out of their house, go to an office, or we don't want them to be stuck, especially during this period of time when help is not necessarily available in an audiologist's office. They can get by, and we can get by doing a video conference like this, and ultimately walking them through. And 9 times out of 10, the problem is solved on the spot.
Right.
for the patients. So super important, especially when communication is critical at this period of time. So yeah.
Exactly. We're all surrounded by our families right now, friends and family. Hopefully everyone's safe, healthy, but this is a time where we need to actually hear what everyone is saying.
Yep.
Or watching the news, you need to hear what the news is saying. And yes, we can throw a closed caption on, but we want our patients to be able to hear what's being said.
Yep.
And I know that there's another capability that we were actually discussing or possibly thinking of bringing into the practice. What are your thoughts on vestibular rehab through telehealth?
Yeah, that's a really interesting question. And this is something I give a lot of thought to is what happens when we have patients who are dizzy, because we see a lot of dizzy patients. And again, it can be equipment intensive, especially to truly understand what's going on with somebody to lead them down the right path for care and for rehabilitation. I can give you a perfect example. I had a patient who called and she described what sounded like a very specific cause of dizziness.
Mm-hmm.
And we measure the eye movement. That gives us a lot of information about the balance system. It's not perfect when I can't see or put my hands on the patient in terms of
Right.
the true evaluation, but based on the case history and based on what the patient was describing, I had the patient videotape, with their phone. Videotape is an old term, I'm sorry.
It's fine.
record through their smartphone their eye movement when they moved into a certain position so I can see what their eyes were doing. And lo and behold, it was that specific cause of dizziness, which is called benign paroxysmal positional vertigo.
Mm-hmm.
Something that can easily be fixed if we know what it is. So what I was able to do was put her in touch with one of our physical therapy colleagues who is working remotely, who also is seeing patients on a very limited basis in office.
Mm-hmm.
Was able to help walk the patient through and ultimately help them fix themselves, because that's something that we can fix through a series of head and body positions.
Right.
That's not going to always be the case. Certain cases of acute vertigo, which we're starting to see more, especially during seasons with viral infections, not just COVID, but there's other viruses out there that can cause these types of infections and ultimately impact our balance system. But some things we're starting to understand how to use these tools. We're starting to get creative, basically.
Yeah.
So it's not a perfect science, and we always recommend we want to get a full evaluation on those patients, but we're starting to incorporate what we do with what our physical therapy colleagues do to actually at least provide some help until we can get back in the office for patients. So interesting times we live in, though, and
Absolutely.
everybody's getting real creative with the technologies that are at our disposal. So
Absolutely.
well, I thought that was great information. I appreciate your insight on the hearing part. I was not prepared for the balance part, but thanks for that question. And if you guys have questions out there, you can send them to info@newyorkhearingdoctors.com, info@newyorkhearingdoctors.com, and we'll be happy to try to address them in a future video. With that, I will see you later, Dr. Naim.
See you later.
Thanks for your time today. We'll talk soon.
Bye.